Nick Dorich, originally from Narragansett, Rhode Island. I attended University of Rhode Island from 2005 to 2011, graduated from the Pharm.D program in 2011. And for me, I was very excited as a student to attend the University of Rhode Island College of Pharmacy. I was the first person in my family to go into healthcare in any kind of way, shape, or form. And I decided on that because I met a URI pharmacy faculty member at a career fair during my sophomore year of high school, and was convinced that I wanted to go and be a pharmacist. So that became a very quick and easy decision when I started looking at pharmacy school programs. Grew up 10 minutes from the campus, so knew how great the campus was. And then the URI program, as I started to look at different pharmacy programs in New England, but then also somewhat outside of New England, I quickly realized that, with my review, that if I wanted to be successful within that, there was no reason to really leave the state of Rhode Island, which was fortunate. So I did apply to a couple of other pharmacy schools besides the University of Rhode Island, but fortunately was accepted to URI. I attended there for the 6 years of pharmacy school, and I enjoyed my experience with the University of Rhode Island.
Yeah, definitely. It's a tough program to pass up on, especially if you kind of know that pharmacy is for you. Really not a whole lot of downside, especially being from Rhode Island myself is a big factor in that as well.
Certainly, yeah.
So if you wouldn't mind just kind of giving a summary of your career since you've graduated, the kinds of things you've been involved in, maybe.
Sure. So when I attended University of Rhode Island, I was involved with a lot of work with the APhA ASP chapter, was involved in some work with the state association, had some experience with the board of pharmacy, and that got me really excited to do some work that was non-traditional for pharmacy practice. And because of that, I applied for a number of executive residency programs with some pharmacy associations. By and large now, they're known as executive fellowships. And I was fortunate to land with the National Association of Chain Drug Stores Foundation, or NACDS Foundation, for their executive residency program. So I was their resident from 2011 to 2012. And then I stayed on board with that organization as a staff member in a joint position for NACDS as the trade association, but then also for foundation operations, stayed there for 2 years. I led some of our education programs, CE administration, pharmacy practice initiatives, and then also worked with some of the government affairs team from NACDS, because it's a trade association. It represents the pharmacy chains, so it's representing CVS as a pharmacy organization, or Walgreens, or Stop and Shop, or Target, etc., rather than the individual pharmacist per se. And then on the foundation side of things, I worked on various research projects related to how pharmacists improve care for patients and help improve health outcomes. So we worked on a number of projects that related to expanding community pharmacy residency programs, provided seed funding for 30 programs, did a couple projects related to transitions of care and pharmacist involvement with medical homes. That was really interesting and positive. And then as well, did some other projects related to point of care testing. So even now, point of care testing certificate program, that was something that we had developed with some researchers at that point in time. And I also launched the NACDS Foundation Faculty Scholars program, which is intended to help professors and College of Pharmacy faculty that are earlier in their career become more qualified as community researchers. So that was all a really great experience. But then after a couple years, I ended up leaving NACDS. And since then, I have worked for Pharmacy Quality Solutions, or PQS. We're more of a technology company, and we work to provide standardization, transparency, and neutrality for quality measure performance between pharmacies and managed care organizations. So I've been in a number of different roles in the almost 7 years since I joined PQS, but make it very quick, my role with the organization is I'm an account manager. I handle some of our sales and operation with pharmacy organizations, as well as doing training, education, and consulting for pharmacies on how they can use our dashboard and how they can understand quality measure performance to improve patient health outcomes.
Yeah, it's interesting to hear all that because it definitely does sound pretty unique compared to a lot of different kind of more maybe clinical pharmacy positions, like people working in hospitals or in community. Um, I guess, how did you become interested in the more like technological, like maybe macro is a good word for it, like aspect of like the pharmacy practice?
Yeah, I started getting involved with a lot of different items related to legislation, regulation, even when I was in pharmacy school, and I quickly found an interest in doing those sort of things. And for me, that's an important aspect that I think every pharmacist should be involved with. Every pharmacist has their day job, and it's going and doing patient care, be it in a community pharmacy, in a hospital, health system, whatever else that may be. But the importance of advocacy for every pharmacist and how it relates to patient care, how it just relates to how you work as a pharmacist, I think is incredibly important. And that was really one of the biggest drivers for me. So when I was going through pharmacy school, my years in the Pharm.D curriculum were 2007 to 2011. And I used that as a key point in time, because what was the big conversation around healthcare at that time? It was the Affordable Care Act, or Obamacare. And so there was a lot of considerations that went into that, including more utilization of quality measures and how that related to Medicare Part D. And so I was involved with some projects related to that in Rhode Island at the time, and working with some faculty or adjunct faculty or other thought leaders in the state. And when I was during my residency year, I was on a task force that helped develop a new measure for primary medication non-adherence, or PMN. So that was a really hands-on experience 1 year out of college into what actually goes into developing a quality measure. And it's not something that just appears out of thin air. It takes a long time to really understand how that measure can be used in the marketplace. Is there a necessity? Would this be valued by stakeholders? And ultimately, does it improve patient care? So I stayed involved with that kind of work for my time at NACDS. And then when PQS as a company was starting off at that point, I was hired as one of the original staff members with that organization. So in my company portal, I'm listed as employee number 6 with that organization, which is a pretty cool thing to look back on. But for me, it all came down to this was just an area where pharmacist and being a pharmacist, having that Pharm.D, there's many pharmacists, and most pharmacists are going to go into providing direct patient care, but there's a much bigger world for healthcare, and there's a much bigger world as it relates to how we understand healthcare, how healthcare is paid for. And to me, it's important that every pharmacist gets involved with that type of work. And I'm just fortunate enough that I get to be involved with that kind of work. I get to do that as my day job.
Right. I'd say, obviously, as pharmacists, we want to be kind of, how do I put it? Like involved with as much as we can, almost, kind of making the most out of our degrees, because we do have the skills to do a lot. So kind of dedicating your work into enabling pharmacists to like be that healthcare provider that can provide tons of different services for pharmacists sounds really kind of empowering. How would you say, so your residency was, I'd say, like involved with your current line of work. How was the kind of transition from being a student into residency, being that the residency was maybe a little bit different from what a lot of other residents might experience?
Yeah, certainly was heavy on research, heavy on office operations, communication, working with other healthcare providers, but really working with a lot of decision makers for organizations. From that standpoint, and that to me, I think, is where it becomes really important for anyone who's interested in pharmacy. That really becomes a key area to become proficient in. Going through pharmacy school, and when you're in the classes, head down, whether it's a curriculum class or whether it's a practice lab or even APPEs, those are mostly focused on patient care, understanding how the medication works, understanding the appropriate dosing, understanding how to manage and counsel that patient. But again, there's so much more that goes to communication. And from my own standpoint, I think that's one of the biggest advantages from my experience at University of Rhode Island and the College of Pharmacy. It's been a school that has long had a lot of support for many of the extracurricular groups that are affiliated. So be it some of the pharmaceutical fraternities, be it some of the associations and their student chapters that's there, URI has always had a lot of support. And the importance with those organizations and the importance of being involved with those organizations is that it helps you to build and to practice on a routine basis how you manage meetings, how you conduct outreach to other students, fundraising, or even just how you're working with other local businesses in the community for events, other things like that. Those are all skills that are in some way, shape, or form really important to being effective as a working professional. And especially depending on what you do, if you're in a hospital, if you're working as a hospital pharmacist, at some point you may end up on a P&T committee, and you may need to understand financials and how that works for an organization. So even some experience or involvement with understanding a budget for an association, that helps. And so for me, it's important there, the Pharm.D and the classes and that you take, that helps you be a pharmacist. That gives you the clinical knowledge to be a pharmacist, but how URI supports its students in all those other extracurricular activities, that helps URI graduates really become top-notch pharmacists. And that's one thing that I've seen and understood from my time working at NACDS, working with schools of pharmacy, working with pharmacists in different practice settings, and in my experience now with PQS, URI pharmacists, they're not just good pharmacists from a clinical standpoint, they're really good people at understanding how to communicate and how to be effective leaders. And that to me is perhaps the biggest advantage that I've had from my experience at the URI College of Pharmacy.
Right. There's certainly no shortage of things to get involved with at URI, which is really cool. And I think something that might be at least somewhat unique to URI is that the College of Pharmacy is part of like the greater University of Rhode Island. So the people that you're meeting like every day are going to have different backgrounds. Like some of the best friends that I made during my time at URI weren't in the pharmacy program. I lived with a ton of non-pharmacists. So I think it kind of gives you a little bit more perspective almost as to like the ways different people, different types of professionals communicate and how to best kind of, I guess, be able to communicate with all different types of people, which is very cool. This could be kind of a tricky question, or I have a feeling it'll be a tricky question, but as far as like the day-to-day goes for your current job, like how would you say, or maybe even just like the scope of like a week, how would you say you operate kind of regularly in your position?
Yeah, my job is more of an office job. And so 9 to 5, 8 to 6 type of hours, Monday to Friday. So my schedule is very different from what would be the typical pharmacist who's working in a community pharmacy and open when they're open, or even a hospital pharmacist. So that part of it, to me, I have a job that's fairly normal in its hours compared to what would the general American public would have. And we're not traveling right now for conferences or meeting clients, that sort of thing. So I work from home, and that has its own bit of excitement, including my my roommate and coworker that's very fluffy and likes to bark on many of these calls. But that's a nice benefit. But as far as the day job goes, the key part for my job, it's understanding and interpreting data for quality measures with the companies that I work with, helping them understand, track that information, and how they utilize that to strategize and improve patient care further, or how that may relate to their financials as an organization. So sometimes that's good news and good information that, hey, you're doing really great, and this is what you can expect as far as a financial return, or this is how much you're helping patients be adherent for their medications or adhere with clinical guidelines. And sometimes there's conversations where it's not quite so fun, where when it comes to that, not everybody, we like to have everybody improve, but not everybody does. So there are more difficult conversations that's there. But so I spend a lot of time looking at data, spend a lot of time working with organizations on how they're educating, training their pharmacists, spend a lot of time as well understanding different programs, because there's always evolutions to different measures that are used in the marketplace, or how different programs use different quality measures. So the one thing that's really interesting and that I enjoy about the space that I work in, quality improvement in healthcare, that is a continuous process. So if you're not improving, if you're not doing something different, you're doing it wrong. And that means you always have to be learning, a new skill set, and you always need to be getting better. So for someone like myself, I'm pretty competitive by nature. That fits really well from that standpoint. But then at the same time, a lot of my job, I get to spend time working and communicating with frontline pharmacists. How are they using this data, and how are they implementing that with their patient care programs? So that's the part of my job that I enjoy most. I don't work with patients directly in my job, and it's been a long time since I've worked with a patient directly in any way, shape, or form. But I get to work with pharmacists across the nation and help them understand data that goes to help them improve their patient care. So I'm not touching patients, one by one in these patient intervention or these patient encounters, but I'm helping pharmacists better understand their strategies, and that impacts a lot of patients over the course of the nation. So that's part of the job that makes me feel really good and really positive.
Yeah, that's really cool. Would you say you've observed maybe the role of kind of like performance analysis? Has it changed since you first got into the space, or do you see it maybe like continuing to grow or gaining value perhaps?
Yeah, it certainly has. Especially with the work that I see and working with organizations, having a good understanding of some basic data programming, some basic data capabilities is certainly a positive for pharmacists. Many pharmacists that go into residency training, as an example, are going to be a bit more familiar with perhaps some basic coding or programming that they can use with research studies and programs, understanding clinical significance, et cetera. There's a lot of different groups out there that are, if you need to take a crash course in understanding some basic data crunching, there's a number of groups you can just go online and find ways to do that, aside from just going and getting a master's. There's a lot of formal ways to get that education as well, but even informally, you can go and do that. And to me, I think that's something where, again, I think I said this part earlier, having your Pharm.D, that is the entry level degree to being a pharmacist. And as a pharmacist, when you graduate, you take the oath of the pharmacist there. Continuous education and continuing to improve yourself so that you can improve patient care. That's part of the profession that we do. And having a better understanding with data and programming is a great way for many pharmacists to do that. But it's not the only way. We need to have pharmacists that understand those components. We need to have pharmacists that are getting better at doing those direct patient care activities as well.
Right. Have you yourself kind of undergone any additional certification for anything like in addition to the Pharm.D that has helped you kind of operate in your position?
I did my residency, and then since then I've done a number of trainings around project management and leadership courses, some business and sales consulting type of training, but nothing formal at this point. I've poked around on some areas around, do I go back and try to complete a master's in an area, or do I want to get any other official kind of certification? And I've looked around a lot of those areas. I haven't made a decision just yet on what that path ahead looks like for me, but certainly education training has been a number of different, there's been a number of different other details that have been reviewed through my experience.
Okay. And something I'm curious about, so, and you've touched on it a little bit about how you communicate with a whole lot of pharmacists in regards to potentially like ways to like maybe improve patient adherence or just outcomes in general. So how is that usually conducted? Like how do you go about kind of presenting data perhaps to different pharmacies or pharmacists in order to try to get them to maybe like have more positive outcomes?
Yeah. So with our company and our platform EQuiPP, that is a data platform. So it does have tracking and trending over time for a pharmacy and some of their performance information in aggregate. And then it has various breakdowns and comparisons. So a pharmacy can see, for example, how they're performing compared to the average for the organization that they're in or the state that they're in, or they can see scores by different lines of business or scores for different payers. So it does take a bit of familiarity. I often equate it to EQuIPP is kind of like a roadmap, and it provides you that context or information. But if you don't have the roadmap oriented the right way, you're going to end up taking the wrong turn and you're going to end up being lost in the forest. So more information and more data is a good thing. But the context for how you use that information is of the utmost importance. And I point that out with data at the same time. It's very easy in the world that we live in to take data as a be all end all. And many pharmacists have a lot of measures or metrics that they may be, they may deal with at work, but all that information is the context for that information is really important. Does a pharmacy have appropriate staffing? Does a pharmacy have the appropriate tools and resources? Do they have the appropriate people? Is their dispensing system set up for success to be able to conduct these interventions? The data, I think, points a lot to those important questions, and in helping a pharmacy understand what they're doing to be successful, or where they may need to put in some more resources to help counter some of that deficiency for performance. So I think of it actually a lot like a SOAP note. The measured performance, that's the objective information. But what comes first in the SOAP note? It's the subjective information when you're assessing a patient. Same thing here. You need to have that subjective assessment along with the objective assessment, because otherwise your assessment for the situation, if you don't include both, your assessment is going to be faulty. And if you don't have a good read, your plan is going to be ineffective at addressing the care or the intervention that needs to occur. So data is a really key point, but data just by its own or siloed is not very helpful.
Right. I know for a lot of people, maybe myself included to a degree, but kind of looking at large quantities of data can be a bit intimidating. Would you say that like communicating maybe like the big points of like the different assessments for pharmacists, do you ever have problems like communicating maybe how they should go about making improvements, or is that something that maybe comes a little bit easier because you're usually working with pharmacists?
I think of this idea, and it's a great question, Mike. I think of this a lot like initiating drug therapy for a patient. So if you've got a patient that needs to be taking a medication and they're just starting it, the methodology is that typically you're starting that patient slow and low on that dosing, right? So you're starting slow and low, and then you're titrating up that dose or the frequency so that they can achieve that maximum clinical or therapeutic benefit while also avoiding any side effects for the medication, right? Because if the patient isn't able to take the medication, they can't tolerate it, side effects are not acceptable, et cetera, that medication's not doing the right type of good. And the same thing goes to conversations with pharmacists and with pharmacy teams. And I say pharmacy teams because it's not just the pharmacist, it's the pharmacist, it's the pharmacy technician. And working with many of these organizations, I may be working with a pharmacy owner that is not a pharmacist, and they don't understand adherence because their background is they're a business owner, right? So that's where the communication becomes really important, because for a group that's doing well, them doing well at that point in time, that's really good and it's important at that time. But if they don't ever change anything and they just think, hey, we're doing well last year, we're not going to change anything different, that doesn't necessarily mean that they're continuing to do well in this new year. So it really is important for them to have a continuous process. And then the same thing for the pharmacy that's doing poorly. If you go in and just start telling them, hey, you guys are not performing well and it's hurting your patients, no pharmacist, I mean, not just pharmacists, nobody's going to respond well. So you really have to understand how to have an effective communication plan. If you're familiar with the idea or topic of motivational interviewing for patients, that same process applies to having this conversation with pharmacists or with business owners or whoever that is there in the organization. You really have to have people understand why this is important. You have to have them understand that it may be making some difficult or tough choices and that they have to be willing to change. And then you get into that kind of tough conversation. So, from that standpoint, I apply a lot of those same processes processes that I learned in pharmacy school, but I learned motivational interviewing in the pharmacy practice lab about how to work with a patient. I now apply those same processes for a business conversation on how they understand this data.
That's a very interesting analogy to make because it seems very accurate. If you want your medication to work, you got to take it, right? That's really cool how that kind of translates over in its own kind of unique way. And so I know you've kind of mentioned it a little bit, but what about your position or career kind of is the most rewarding aspect of it for you?
Yeah, there's a couple things that come to mind for me, and a lot of this goes back really to my time at the University of Rhode Island and a lot of the encouragement that I received from faculty and the community that's there. Pharmacy is a very small world. And when you're starting off at the geographically smallest state, that becomes even more obvious. But that really can be an advantage as well. I talked about my engagement with professional associations and how that really set me on a path. I continue to be involved with professional associations. I'm heavily involved with the American Pharmacists Association, continue to be. I'm currently an executive officer for one of the academies within the APhA. And, I do my day job and working 40 plus hours a week, really helping pharmacies improve and understand, data and other components. But working with the association is another way that I'm continuing to grow and to build my network. It's a way that I'm continuing to advocate for pharmacy and its role in improving patient care. And again, that all goes back to my experience at the University of Rhode Island. I had a lot of mentors that were either faculty at the school or they were preceptors at the school, or they were just folks that were involved with the state association or the board of pharmacy, and they were often that were there. So my foundation from that experience at URI, I certainly wouldn't be doing many of the things, or maybe I wouldn't be doing any of the things that I do, or I wouldn't be in the position that I'm in to do these things if it weren't for my experience at URI. It's a very unique environment and one that I'm very grateful to have experienced for my time there in the program. So, Mike, does that answer your question around the success and how that ties in?
Yeah, I would say so. So I guess just to quickly touch on the APhA aspect, you mentioned how you're still like staying involved with APhA. I'm just curious about maybe the kind of things you do still with APhA and I guess what your experience have been like kind of working your way through that.
Sure. I've been heavily involved with APhA. I was chapter president as a student at URI. I am one of two URI students, or I guess alumni, that have been national officers for APhA and its Academy of Student Pharmacists. The other one being Linda Nelson, who's still a pharmacist in Rhode Island, another great person. But so it's a pretty unique opportunity that we had there. And for me, it's just really important being involved. I was involved with the new practitioner network just a little bit with communications. I've been heavily involved with APhA and its House of Delegates and policy process. That becomes really important because as a member association, APhA and its board of directors, they really have to refer to their House of Delegates and their policy as to what's important, how they address different topics. This may be things related to drug pricing or pharmacist provided services, or even things like mergers and acquisitions in healthcare. If APhA doesn't have a policy statement for it, it's very difficult for the association and its leadership to have a conversation with other healthcare professionals, or if someone from CMS contacts APhA to say, hey, how do pharmacists think about this? If there's not a policy, it's not really possible to have a response that's there. So for me, that's been perhaps the most impactful area where I've been involved. I've been involved with the House of Delegates for almost every year for the last 10 years. I've been on a number of committees with that group. This past year, I chaired the Policy Review Committee, which was an incredibly rewarding experience, but also perhaps one of the most stressful experiences that I've been involved with, to think, hey, is is this policy that was written in 1980, as an example, is that still relevant to the association and how we feel as as a body? And then being involved with the academy has also been incredibly rewarding, because you're representing, in my case, the Academy of Pharmacy Practice and Management. So practicing pharmacists across various spectrums of patient care. Again, a very unique and rewarding experience in how APhA operates their special interest groups, how they're promoting education, certificate programs, how they're promoting resources that are available so that other pharmacists can continue to grow and expand service opportunities and receive payment for services that pharmacists are able to provide to improve patient care.
Well, that's certainly quite a bit of involvement. Definitely sounds very interesting to kind of continue being able to contribute to like such a massive organization like that. I think we touched upon most of kind of the big things that I wanted to, and it's been 30 minutes, so I don't want to keep you too long. My last question for you would be, what advice might you give to either an aspiring pharmacy student, or maybe more specifically URI pharmacy student, who might be just entering the program or thinking about like applying to enter the program?
Yeah, there's a key word that I use in my everyday work at PQS, and it's a really big one for myself and a couple of my coworkers. And that word is intentionality. And it's the idea that if you're doing something, you're putting your all into it. You're going, 0 to 60, 100 miles per hour. And if you're doing something, if you're executing on a topic, you got to put everything into it, and really do everything that's there. I think a lot of that mentality I absorbed from my time at the University of Rhode Island College of Pharmacy. It's a very competitive community for sure, but it's also one where it's very community driven. And the part of that I think is important is that another phrase or metaphor I've heard is that if you want to get something done fast, you go alone. If you want to get something done well, you go together. And that I think is something that works really well with kind of a mantra idea around URI, the university as a whole, but particularly for the College of Pharmacy. And that's part of something where I think about that every day with my work. It's not just for myself and internally with the company that I work with. It's something that matters for how I work with my clients. If I want them to be successful, I want to make sure that it aligns with their priorities and how they view success, and how they view success for their patient care initiatives. So that to me is perhaps the most important thing. And again, it was reinforced in a lot of different ways, day in, day out, when I was at URI. And it really becomes a driving force for myself, my work at PQS, my work with the Pharmacy Association. And I think it's something that's important for every pharmacist. I said it before earlier in our conversation. Every pharmacist goes and does their day job providing patient care or whatever else it is. But everybody does that. There's a lot of things that happen outside in the world as well that may also impact how you get to do your job day in and day out. And it's important to also be involved with those things, because otherwise other people are influencing or impacting how you get to do your job. And for me, I think pharmacists are great. Pharmacists are underutilized as healthcare professionals. And it's up to us to really kind of make the change and show the value for why pharmacists need to be able to do more.
Right. I really like that. I'd say valuable for just about anyone to kind of hear that. It's just important to, do your best with everything. I totally agree. So I think with that, we are pretty good for the interview. Let's see. Have you looked at any of the kind of other interviews that were posted so far? Or do you know where to find them?
Yeah, I checked out a couple of them. There were a few faces that I saw on the site that were folks that I knew or that I had worked for previously there. So yeah, I checked out a couple of them. It was a pretty cool site. Like how that operates.
Yeah, it is nice. Yeah, I've been very fortunate to be able to be involved in kind of this whole thing. I've definitely learned a ton on just about every single one of the interviews I've done. It's really cool to kind of get all this perspective about different ways people have gone. And I'd say on average, the interviewees, yourself included, are very good at making kind of cases for their lines of work. And it all sounds very kind of fulfilling in its own way. So it's been very cool for me to kind of get a lot of perspective there.
Yeah, the timing for this was great because I was on a panel for the APhA meeting just 2 weeks ago about kind of career path type of stuff. So I had notes written out for that. And as I looked at the questions, it was, well, I have to make this more of a URI specific conversation, but that's not hard to do because everything I said it does tie back to URI. So I luckily had good notes related to this conversation or this idea.
That's good. Yeah, I'm glad it wasn't too much of a burden then. So I'm not sure exactly the timeline on how long it'll take for, I guess, the interviews in particular to be posted. I know there are kind of a whole lot of them being done right now, so it might take a little bit, but I'm sure more information will come out in regards to when all the interviews are posted. I think we're kind of nearing the tail end, if I were to venture a guess, on our interviews, because we've done tons so far. So hopefully everything should be posted soon if you want to check back and take a look.
Yeah, we'll do. That sounds good.
Let's see. But anyways, just thanks for your time. It's, of course, been very interesting for me to learn about it. I've definitely learned a whole lot about something that I didn't really know much about before. And even your advice, it's good to reflect on and, you know, kind of integrate into my own line of thinking, I guess.
Yeah, glad to hear that. It's always a pathway. Like I said during the questions, everything's kind of on a continuous spectrum. That's perhaps my biggest piece of advice. Mike, you're graduating in a couple months here, right?
Correct.
My other piece of advice, don't usually do in the formal part of interviews or these other things like that. My other piece of advice, and do you have a job lined up or and things for after graduation?
Not set in stone yet.
Gotcha. So my one piece of advice in figuring out the job and all the other things there, make sure you have a hobby outside of pharmacy stuff as well, because you go from pharmacy school and school, class, working, IPPs, APPs, all that other kind of stuff like that. And it's a bit of a rat race. Once you get into working, it's generally a 40-hour work week, and you quickly kind of find out that there's a lot more time that you start to have on your hands, depending on how you do that. So if you don't have a hobby that you can, go back to, or maybe there is one you kept while in pharmacy school, but definitely find yourself a hobby, find something that's not pharmacy, sort of related, sort of thing. It's always good to, another degree or something else like that, but something not pharmacy specific is always a plus as well. Gives you good context outside of just the day job and work.